Okay. So I'm gonna verify physician's orders. I'm gonna gather all my supplies before I go in. And alright. So knock knock. Provide privacy and hygiene. Okay. Hi Mr. Jones, my name is Jessica and I'm gonna be inserting an NG tube, okay, to decompress your stomach. Can you verify your name and your date of birth for me? Okay, thank you. Okay, so I have all my supplies here. Put on my gloves. So I'm gonna put a check here so we don't get the gown dirty. Alright. Oh yes. Yes. Okay. Got my pen light. Okay. Mr. Jones, have you had any previous trauma or any surgeries done to your nose? Okay, so I'm just gonna check. Okay, do you have a preference on which side? Okay, we'll go with the right side. Alright, everything looks good. So from here, I'm gonna measure the NG tube. Okay? So I'm going from the tip of the nose to the earlobe to the xiphoid process. And from here I'm gonna mark it with a piece of tape. Might not reach this far because of the mannequin, but okay. And then from here, I'm gonna apply lube. Okay. And I have my assistant here, so when I reach the back of your throat, what I'm gonna do is I'm gonna have you kind of tilt your chin down to your chest, and I'm gonna have you take some sips of water, okay, to advance the tube down into your stomach. So I'm applying the lube. Okay. All right, Mr. Jones, and here we go. 1, 2, and 3. So inserting. Once I reach the back of the throat, we're gonna tilt your head down, okay, and start taking a sip of water to advance. Okay. And then from here, I'm gonna hold the NG tube in place, secure it. So as it's in place, I'm going to check the pH. So draw back, check pH, anything between 1 and 5. Okay, and then also obtain an X-ray order as the gold standard to check placement. From here, I'm going to secure the NG tube to his gown and then apply it to suction. And I'm going to remove my gloves. I'm going to document patient tolerated well. I'm going to document the pH value, the type and size of the tube used, and also the measurement of the distal tip, and confirmation with an X-ray, and hand hygiene.
You just pun.
Okay, so verify patient or physician orders to remove the NG tube. So gather all my supplies. All right, so knock knock. Hi, Mr. Jones. My name is Jessica. I'm going to be your nurse, and we're going to remove your NG tube, all right, because you're doing well. And I'm going to verify your name and your date of birth. Okay, thank you. Hand hygiene, provide privacy. All right, so I have a text here. I'm going to place it on your chest. Okay. All right, I got gloves. Okay. So I have adhesive remover to remove the tape and secure it from his gown. Okay. So what I'm going to have you do is I'm going to have you take a deep breath as I take it out, okay?
So it can start right away.
All right. Okay, ready? 1, 2, and 3. dispose of this and the chucks in the proper receptacles. Okay, remove my gloves. Alright, document patient tolerance, hand hygiene, and I'm going to also patient education, such as we're going to keep monitoring your bowel sounds and so forth.